Technology can be a drug-free alternative to help augment the therapy that you're doing right now. One of the technologies that we like to use here at Family Solutions Therapy is a device called the Alpha-Stim. It's called CES therapy, and it stands for cranial electrical stimulation. What cranial electric stimulation does is it's an intervention on our brain, and it's a really effective drug-free way of changing the state of anxiety and distress that we might currently be in. We use microcurrents and we use electrodes to the ear. That's what makes CES different than if you've been reading about like TMS, where it's transcranial magnetic stimulation, and some of the articles that have been written about that around treating chronic depression is that those are more targeted, and the electrodes are putting more on the skull or above the ears. CES is on the ears. So here's an example of the device. These are electrodes and they clip to the ears. And there is a specialized wave, about a 2-second wave. And with these microcurrents, and microcurrents not to be confused with electrical stimulation therapy, which can be an effective treatment for depression, but it has some pretty severe side effects. These side effects are almost none. It's a very safe, effective way of helping the brain respond to the treatment without having to use high currents or, in some cases, medication. Or this can help maybe even augment the medication you are currently on. And we're helping the brain. If the brain is super noisy, and if we're actually reading, like doing an EEG of the brain, a noisy brain, especially when it has a lot of anxiety, tends to record a lot of what they call high beta waves. The more noisy your beta waves, the more anxiety and the more alert neurologically your brain is. The more your brain is on that watchtower, waiting for the next thing that might hurt me. An alpha wave is in the right proportions when our brain is relaxed, when we feel calm and content. What the Alpha-Stim is named Alpha-Stim, is trying to, or is creating within the brain, is telling the brain that it has to have alpha wave. And when we use the Alpha-Stim on a regular basis, the research shows that it is as effective, in many cases more effective than most of the medication for both treating anxiety, depression, insomnia. And this device is mainly for mental health, but we also have what's called the Alpha-Stim M, which is also medically for pain, where we can change the frequencies and also probe particular areas of the body to help reduce the signals of pain. It doesn't repair the body, but it does help us have less pain recepting back to us, so we can have some relief. The thing is particularly important in mental health when physiologically and psychologically we are having similar symptoms. An example of this would be, especially when we are seeing patients who have substance use disorders, and if they're going through some withdrawal symptoms. Post-acute withdrawal symptoms and acute withdrawal symptoms tend to be the opposite of whatever the drug you've been taking does for you. And so when you've been using like an opiate, for example, which is a pain blocker, the more you're coming off of an opiate, the more sensitive I now am to pain. And the Alpha-Stim M, in conjunction with the Alpha-Stim aid, can help us reduce a lot of those pain symptoms that we feel in acute and post-acute withdrawal. And in general, a lot of these things have been used to help treat post-traumatic stress disorder and also anxiety disorders. Usually, patients can actually report that they can feel some relief from the anxiety within 1 or 2 sessions. And when it's used, as the protocols would have us, multiple times a week for at least 35 minutes at a certain level, that within 5 weeks we see better results than most medications, and those results can last, especially if we have some maintenance sessions to make sure that those results continue. So come in and try the Alpha-Stim. You can do it during your session. You can see how it feels with a practitioner here helping you process it, even knowing how it might help you be more receptive to the therapy that you're receiving. And you can come in outside of your sessions and in between your sessions and just schedule some time in the front office to both sit down and relax, wear the device for a period of time, and even do maybe some relaxation meditation with some neurofeedback. We welcome you to come in and schedule additional times outside of or in between your sessions to do some of this with us.